Okay.
Hi, I'm Sonia. I'm going to be taking care of you today. So normally when someone first comes in for their initial assessment, I would start off by introducing myself after I wash my hands, all of that stuff. So as she walked in, I was assessing her gait, normal, no issues. So next we would start with like a mini neuro exam just to assess her level of consciousness, if she's alert, if she's oriented. So tell me your name.
Tasha.
Okay, and your date of birth.
5/24/72.
Okay. Do you know where you are right now?
Yes.
Where are you?
Tupelo Hospital.
Okay, and who's the president?
President Biden.
Okay, so obviously she's alert and oriented, so now we would move on to assessing her upper extremities. So I see her arms are normal, everything looks good. We would do that on both sides. So I'm just going to do this one side just for the video. So we would assess her brachial pulse. 2+, she's good, pulses are good. Her radial pulse, also 2+, those are good. We assess her hands. She has no clubbing of her fingers. Her capillary refill is normal, less than 3 seconds. And so we would do that on the other side also. So now we'll do some range of motion. So hold your arms out wide. Can you move them up and down? Check your shoulders. Can you come forward? Go up and down, just like that. Okay, let me see you bend your elbows, just like that. So her elbow range of motion is good. Let me see you do your wrists back and forth. Okay, and can you open and close your hands, squeeze your hands? So range of motion, obviously, very well. So now we'll start with her head exam. So I'm gonna touch on your scalp. Okay, so she has a lot of hair. So where we can feel, I don't feel any abnormalities, top of her head, behind her head, anything like that. Hair looks good. So now we'll palpate her sinuses. Everything looks good here. Go ahead and check her eyes while we're here. Her conjunctiva is normal, sclera looks good. Okay, can you open and close your mouth? Alright, so no history of like TMJ or anything, everything's good. Okay, eyes look good, pink and moist. So now I'm going to get you to, and they're also, I would take a pen light, we would check her reactivity to the pen light, make sure her pupils are equal, round, and just from looking here they are. So now we'll do your pupillary movement. So I'm going to get you to follow my finger. Okay. Okay, so that's normal. Now follow my finger. Okay, all of that looks good. We could also test by checking the eye chart, so that also kind of steps into the cranial nerves too. So now we'll check her ears. We'll use a light here. Outer ear looks good. Inner canal looks good. Everything looks good with that. To check her hearing, we could do another one of the cranial nerve tests is the whisper test, so we could check that also. So now I'll just go ahead and discuss the cranial nerves. So your first olfactory, so we do the smell test, so get her to smell some type of scent. She could state that. The optic nerve, so we talked about that already. So with the eye chart, the visual fields, her pupils are equally round, reactive to light, all of that. We did the follow my finger, extraocular movement, so we did all of that. So trigeminal, let's check that one. So can you clench your teeth really hard? Okay, can you puff your cheeks out? Okay, can you smile really big? All right, so those are the facial nerves, sorry. The trigeminal, so clench your teeth again. Okay, so then when we do sensory check, so take like a Q-tip and just here, check all of that. Okay, so we did the facial. Now let's do the hearing. So we would do the whisper test. So I would get behind her, whisper a word in her ear, and see if she could repeat it.
Hello.
Okay, so she's good on that. We said hello. The next one, the swallow gag reflex. So we would check 9 and 10. So obviously you can swallow just fine. If I had a, what are those things called? A tongue depressor. So we could check her gag reflex with the tongue depressor, and that would be fine. You don't have any trouble swallowing, anything like that. Okay, so now we'll check your cranial nerve 11. So can I get you to shrug your shoulders up and down? Okay, and let's check your neck muscles and movement. So can you turn your head side to side? Okay, that looks good. And can you look back and down? So good range of motion with that, no abnormalities. And so her speech, as she walked in, I said, hey, how are you? What's your name? All of that. So she told me her name was Tasha. She said she was fine. She felt good. So her speech was clear. She's obviously very oriented. She's alert. So now we can check your tongue movement. So can you stick your tongue out? Okay, can you open your mouth and do your tongue side to side? Like that. Good. Okay, so that looks good. We checked her gait as she walked in. So now let's do a little bit more of the neuro exam. So can you take your finger and put it to your nose just like this? Close your eyes and then put it to your nose. So do it with your other hand. Close your eyes to your nose. Okay. And can you take the heel of your right foot and run it down your left shin like that? Okay, can you do it with the other leg? Okay, so that looks good. So now we'll move kind of down into her neck. So we'll check lymph nodes. Nothing feels swollen here. So we'll check her trachea. Everything looks good. That's midline. Okay, we'll check your thyroid and make sure everything feels fine with that. Okay, so I don't feel anything abnormal. Okay, and then also here we would do the jugular and the carotid exam, so we'll feel those. Inspection already inspected, so everything looks fine. So we'll feel. And we would do the same thing on the other side for completeness. Then next we would listen to her carotid, so we'll do that now. Okay, and if you could hold your breath until I tell you to let go. Okay, so take a deep breath and hold it. Okay, and so we do the same thing on the other side. So now we'll move down to your chest, thorax area. So first we would inspect, so just from here I don't see anything abnormal. We could check for any like CVA tenderness, anything like that on the back side, so let's do that. So I'll just do it on this side. Do you feel any pain or anything like that? Okay, so we would go to the other side and also do that. So now we'll do, we've inspected, so now we will auscultate the lung sounds. So we'll start on the front. We'll start here. Okay, deep breath for me. Deep breath. Deep breath. Deep breath. Okay, we'll go under here. Deep breath. And deep breath. All right. So then we'll move to the back side. We'll start here. Deep breath. Deep breath. One more. Deep breath. And deep breath. One more. Okay. So everything sounds good. Her lungs symmetrical, both sides clear bilaterally, anterior, posterior, both sounds great. Everything's good on that. While we're on the chest exam, we would go ahead and make sure to mention self-breast exams, which need to be done every month, and then you would educate your patient how to do self-breast exams, if they found any abnormals, how to follow up, things like that. So now we will move on to the cardiac section. So we would inspect the chest again just to make sure there's no abnormals. Ask questions like, do you have any chest pain, anything like that going on? And then we would go ahead and listen. So we'll listen to the 5 sites. So here. You can just breathe normal.
Oh.
Okay, I'll lift up here. And here. And then we would also normally get you to lay down and lay on your left side and listen to the PMI. We would check for that. So that's after we do the 5. So the 5 different sites are the aortic, pulmonic, Erb's point, the tricuspid, and the mitral area. So we would make sure to listen to all of those and then document if there's anything irregular. Obviously, she has no heart history, anything like that. There's no murmurs, no rubs, no gallops, anything like that. So S1 and S2 are there. And so then we would move on to the abdominal exam. So if you could, just go ahead and stand up and we'll get you to lay down. So you can walk and lay down on the bed. Okay, so first thing we would do, we'd get her to pull her shirt up, and so we would inspect the abdomen, make sure there's nothing abnormal that you can see just from looking. You would definitely want to ask your patient, hey, have you been having any abdominal pain? So Tasha says no, there's no abdominal pain. And then, so next we would auscultate. So we'll go ahead and do that in the 4 different quadrants. And okay, she has very hyperactive bowel sounds, and you would make sure to listen for a total of 3 minutes just for completeness of the exam. And so then next we would do percussion. So we'll start with her liver and then move to the spleen. So we'll start here. You have no pain, no tenderness, anything like that. Okay. And so then we'll do light palpation through the 4 quadrants. And she said she has no abdominal pain. So if she did, we would make sure that we started with the quadrant next to that and then end with the painful quadrant so that we didn't elicit anything worse during the exam. And then we would move to deep palpation. And she has no pain at all. Okay, so you can sit up now and we'll just check your lower extremity. So you can just sit here while we check those. So we would check her lower legs. Obviously there's nothing, no skin issues, abnormalities, anything like that. We would check this leg also. We would check the posterior tibial pulse on this side. And it's strong, 2+ on that. She has shoes on, but normally we would ask her to take these off and we would check the dorsalis pedis pulse. Make sure it feels fine. And then we would check her toes, her skin, her nails on her feet, and make sure her capillary refill looks good. And also while we're here, we would definitely check and make sure she doesn't have any edema, any swelling, anything like that. And if she reported any, how to take care of it, how to follow up. I think that's everything.